Hello everyone, today is day 3 of ACR 2025 and a lot of data being presented about patients with axial spondyloarthritis, and I found these few abstracts which are very clinically relevant for our patients. Is those patients with axial spondyloarthritis that have inadequate response to first TNF, what to do in them next. There was a prospective study that was presented from 31 centers. The study looked at whether those patients with axial SpA have inadequate response to TNF inhibitors should switch to a different TNF inhibitor or completely switch the class, like to an IL-17A inhibitor. And the study showed that the primary endpoint at 24 weeks was ASAS-40 response, and the study showed there was no significant difference between the two groups. That ASAS-40 response at 24 weeks was similar between the IL-17A switch or switch to a second TNF. So the take-home message from this abstract was that this switching is an individualized decision, shared decision making between the physician and the patient to decide where to switch where to switch to the next medication. Another abstract on the same line was from a Spanish registry which also looked at switching for patients to a different TNF inhibitor or to an IL-17A inhibitor, and that registry also showed that the retention and survival was much longer on patients that switched from one TNF inhibitor to another TNF inhibitor, suggesting that switching maybe within the same family may be better than switching to a different class. And we did a real-world study using TriNetX database where we looked at initial start, what should be their first start of biologic in these patients, and whether it should be a TNF inhibitor or an IL-17A inhibitor or a JAK inhibitor, and we found that the odds of survival were much higher in TNF inhibitors than in patients with IL-17 and JAK inhibitors. So these data need to be looked into further, but giving us some idea about what to start first in these patients with axial spondyloarthritis. Thank you.